I would say the nursing culture here at Parkview is one of service and one of excellence. And I would say that we are relentless in our pursuit of better. It's a goal that everyone who wants to be a nurse around here wants to be a Parkview nurse and does not want to be anywhere else. You know, any nurse around here can do anything that he or she wants to do and be anything that he or she wants to be right here at Parkview. There's really nowhere else to be. And we have opportunities that are nurse-created opportunities, which is just such a unique piece of the culture here that you don't find anywhere else. We really want to make sure that they take that interview experience to get to know us as a culture, and we do something that's really important for us, and we find that it's important for the candidate as well, which is that realistic job preview, and that's a shadowing experience. And we also do a peer interview process, which is for that candidate to actually get to know members of the team where they may end up taking a job. The nursing professional development practitioner, or we call them educators, they generally will reach out to any new coworker who is joining the team in advance of them even starting with us, and they will meet them on day one at their facility, and they will make sure that they are not walking to their department alone. Often they'll have a few different team members that they will bring up to their department. They will show them around, make sure that they have everything that they need on day one, kind of take them under their wing. We also have something that's really unique called the Parkview Onboarding Partners Program, which is any coworker in any department is able to sign up to be that friendly face and reach out before someone starts their job with us here at Parkview. And they can be that one to reach out in addition to that educator. Team members today want to be connected by text or social media, and so they just start that reaching out and establish some connections, start to make friends before anybody even starts. We do require our new graduate nurses to go through our residency program, and that is something that after nurses get out of their Jumpstart onboarding and they go through their unit-based onboarding, they come back and they have residency seminars every month. It's cohort-based, and so they establish relationships with nurses who are going through things at the same time they are. There are certain milestones in the way that you feel and the things that you need to learn and how receptive you are to learning things. It's very important that all of our leaders understand, that all of our nurses understand. Anyone who wants to be a Parkview nurse understands what a gift that is, and I would highly encourage everyone who is a Parkview nurse to prepare to go through that residency because of that gift that it is. It sets everyone up for success, not only our nurses, but our patients. To be a Parkview nurse is to be among the most elite nursing practice environments in the entire world. Many people know that we are Magnet recognized as an organization which is among the top 7% in the world in practice environments, which means that nurses are at the table making decisions that impact the way that we deliver care and the way that patient outcomes play out. It is very important that there is a structure that allows for nurses to bring forward ideas that when something needs to be improved, their idea can be heard, it can be tried, and it can be measured. And if there are measurable improvements, it can be looked at and disseminated, and improvements can impact patients in a positive way across the entire organization. At the department level, we have nursing clinical action teams, which is a small group at each department level where nurses come together, they evaluate their outcomes related to patient care in their area, and they look at it and they say, what do we want to focus on? What can we do better? And that is where they innovate, that is where they evaluate what may be better practices out there that others are doing. Through that, then they share their ideas, they share their outcomes with nurses across the entire Parkview Health organization, and we adopt practices and we spread those. Sometimes we publish. It's pretty neat when we see an idea come from one clinical nurse. The work and the ideas of one nurse can benefit not only Parkview patients, but patients across the nation or around the globe. We have a subset of coworkers who are nurses here who just came out of nursing school right into a pandemic. And so for them, it's really important that we take a step back and we say, what does this group of nurses uniquely need? In the beginning of our COVID response, Parkview as an organization did wonderful things for our coworkers, whether it was providing very quick reassurance that there were childcare options so that people did not have that to worry about, so that they could, continue to work and care for patients and serve the community, whether it had to do with groceries or whether it had to do with access to applications for stress reduction or mindfulness. We did things that maybe seemed like small things in the beginning, but these are building blocks for resiliency. Proactively as an organization, we brought in the reserves, we brought in more help for our coworkers because we knew what was in front of us. We saw a lot of leadership from our coworkers, from our nurses who haven't practiced at the bedside in a long time. We saw leadership from nurses who work in quality, who came back to the bedside, nurses who work in education, organizational development, other areas of the organization who have stepped away from bedside patient care and who stepped right back into it. And they may not have taken a patient assignment because maybe what was needed of them was their leadership, their critical thinking, and being right there to reassure all of our newer nurses, whether new to the organization or new to the practice of nursing.